serum protein electrophoresis and immunofixation are integral parts of the diagnosis and monitoring of patients with myeloma and other monoclonal gammopathies. But as we all know, they have limitations due to their limited sensitivity, as well as the interference with monoclonal antibodies that we all use for the treatment of myeloma patients. So mass spectrometry is based on the specific molecular mass of each patient's monoclonal protein, and so the method is able to identify this specific molecular mass. So the combination of both, I would say, so the fact that each patient with a myeloma has a specific immunoglobulin with a specific molecular mass, and the fact that mass spectrometry is able to identify this, so allows us to diagnose and follow these patients using mass spectrometry with a higher sensitivity and specificity as compared to conventional methods. So the Spanish Myeloma Group, so we have investigated quite a bit the role of mass spectrometry in patients with monoclonal gammopathies. So basically what we have done is in the context of clinical trials carried out by the Spanish Myeloma Group. So we have analyzed and compared the results of the conventional methods, serum protein electrophoresis and immunofixation, with those obtained using mass spectrometry in serum, as well as with the results of the analysis of MRD in the bone marrow of our patients. So what are the main conclusions regarding this? So the first one, so as compared to conventional methods, mass spectrometry is more sensitive, so higher sensitivity at all the time points that we have analyzed. So when we include in the analysis of mass spectrometry the free light chains, so it increases a little bit higher the sensitivity of the method, and so the sensitivity of mass spectrometry continues to be a little bit lower as compared to next generation flow analyzing the bone marrow of the patients. So what about the clinical value of mass spectrometry? So we have analyzed this post-induction, post-transplant, post-consolidation, and after 2 years of maintenance. So whereas conventional methods lack their prognostic value post-consolidation and after 2 years of maintenance, so mass spectrometry retains this clinical value in terms of progression-free survival. And of course, so the analysis of MRD in the bone marrow by next generation flow has a very significant prognostic value, a little bit higher as compared to mass spectrometry. So are mass spectrometry and NGF in the bone marrow complementary? So in our hands, they do not seem to be complementary, since so when we look at the Kaplan-Meier curves, so the prognosis in terms of progression-free survival of double negative patients, that means NGF negative, mass spectrometry negative, so it's completely superimposable to that of patients mass spectrometry negative regardless of the results of MGF, and NGF negative regardless of the results of mass spectrometry. So they does not seem to be complementary between both methods. So we have analyzed the combined results in a way to see which one is the winner, so which method has more prognostic value. So in our hands, again, so NGF seems to be favored at all the comparisons that we have made so far, but still mass spectrometry a very high negative and positive predictive value. And finally, as expected, so not only the achievement of mass spectrometry negative, but to maintain this MRD negative status but mass spectrometry, so it's associated with even a higher clinical value as compared to patients that just achieve mass spectrometry negativity at a single time point. We have seen this with mass spectrometry, and of course we have confirmed so the previously known results about this using next generation flow in the bone marrow. And I think those are the main results of our studies using mass spectrometry in the context of the trials of the Spanish Myeloma Group.